Speaking of vulnerable and speaking about impact, here's the update on our COVID case numbers in the state of California. The last reporting period, September 7th, you'll see shy of 3,000 new cases in the state, 2,676 to be exact. The 7-day rolling average now 4,302. If those appear to be more promising numbers, it's because they are. Over the last 14-day period, we've averaged just shy of 114,000 tests over the last tests per day, about 110,000 yesterday. The test numbers are starting to come back up after the impacts of some of those larger fire complexes. We now are running over a 14-day period, 4.3% positivity rate. In fact, it's dropped to 3.8% over a 7-day period. So 3.8% 7-day positivity rate in the state of California, 14-day positivity rate of 4.3%. Again, these are numbers in the aggregate statewide. Hospitalizations in the aggregate statewide have dropped 24% over the last 14 days. Now 4% of total number of COVID patients represented in our hospitals beds system-wide. So 4% of those that are hospitalized in our entire system are COVID-19 positive patients. That is down substantially as well. Good progress in this space. Following that progress, ICU admissions are also trending downward, 21% decrease over the last 14-day period, and that represents 13% or so of all of the ICU patients in our system. So when you make progress in the aggregate and you get below 5% positivity rates, we now dropping below 4% on the 7-day. We are asked the question, understandably, what about more modifications on reopening the economy? As you recall, we put out recently new simplified metrics to determine how and when the state is allowed to move forward sectorally and regionally throughout the state of California. The foundational county movement is determined by simple metrics, including case rate and test positivity, total number of people that are tested, and that's the percentage of people that test positive. Dr. Galley in a moment will come up, update you on that effort. And I just want to, before I introduce him, remind you that the blueprint for a safer opening is to simplify with 4 tiers, 4 colors, the purple, red, orange, and yellow. He will present where we are on the statewide approach, which is much more simple, obviously extends more stringent considerations based upon our experience going back a number of months ago, but is framed with the chart that Dr. Galley will explain here as he also updates you, as he will start doing every Tuesday on the updated map of those that are in the purple, red, the moderate orange, and the minimal spread yellow. In those maps, he'll be presenting that update on those counties in just a few moments. With that, let me ask Dr. Galley to come up and walk you through some of these details.
Thank you, Governor, and good afternoon. Just to reiterate a couple of points that the governor made, we are now into the second week with our new framework, really to work with counties, and I just want to say a deep, heartfelt thank you to all the county health officers, boards of supervisors, many others who've been in communication over the weekend, over the last week about this framework and how it impacts their counties, how it rolls out statewide, and really just an continued unprecedented level of partnership and gratitude to all of them. Again, this concept of slow and stringent is really important for California as we begin to see the reductions in case numbers, the reductions in our hospital and ICU numbers overall, Those are all very promising signs, but gains that we want to make sure we hold on to. And that as we enter flu season, as we go into winter where certain activities are harder to do outdoors, we want to make sure as a state we go in with the lowest levels of transmission. And our framework really is designed to help us get there. Again, as the governor mentioned, 4 colored tiers. Widespread is purple, substantial is red, moderate transmission is orange, and minimal is yellow. And each of these on a weekly basis, every Tuesday, we'll be announcing where counties are relative to these tiers. Last week, or 2 Fridays ago, we announced the official first unveiling of this, where each county landed. And then we said today we would be reporting the second reporting period of this framework and updating all of you and all of the counties where any movement happened. So that's what I'm going to do with you next. So just to remind you, when we first came out with this tiering system, we had 38 counties in purple. That was widespread. We had 9 counties in red, 9 in orange, and 2 in yellow. We had said, just as a reminder, that a county will remain in a tier for at least 3 weeks and will only move to the next tier if they've met that next tier's threshold, data thresholds, for 2 consecutive weeks. So this week, we announced that we moved 5 counties from purple tier to red tier. That's 33 counties now in the purple tier, 14 in the red. Orange and yellow stayed stable at 9 and 2, and that's only because we're requiring counties in red, orange, and yellow to spend at least 3 weeks in each of those tiers. So next week, we may see some movement between red, orange, and yellow, so stay tuned to that. In terms of the counties that moved to red, it's 5 counties, as I said: Amador, Orange, Placer, Santa Clara, and Santa Cruz all moved from purple to red, meaning that they have now met for 2 consecutive weeks the threshold around data metrics. That's the test positivity and the adjusted case rates that we track over a 7-day period, for a 7-day average with a 7-day lag. And each of these counties now has moved into red, and you can go to the state's website, covid19.ca.gov, and see what exactly that means in terms of sectors that are open through the state health officer order. But I'll remind you to double check your own county website, where there may be further restrictions a little bit stricter than where the state is. So with that, that's our update. We look forward to the next update next Tuesday, reporting how counties are faring with this new structure. And we will, throughout the course of the week, be in deep conversations with county leaders, both at the health level and in other leadership roles, to ensure that we're updating these data and communicating it clearly and concisely so all citizens are aware of where their county is and the state as a whole. Before I turn it back to the governor, we are continuing to work with a number of people at the county level and broad sets of experts around issues of equity to introduce an equity measure into our framework to assure that we continue to address the disproportionate impact on certain populations of COVID and to ensure that we all move forward together. So with that, I'll turn it back to the governor. Thank you.
Thank you, Dr. Galley. And so 5 counties now moving into different tiers. Just as a preview, and forgive me, Dr. Galley, we're monitoring roughly 7 additional counties that we anticipate will be moving over the course of the next week. So there's a lot of activity in this space, a lot of progress that's been made in the state of California, getting that positivity rate down to 3.8%. But a point of caution, point of consideration. 3-day holiday weekends have not been advantageous in terms of the mitigation of the spread of this virus. You look back at some seminal periods where we experienced larger spread, a large surge of transmissions tended to occur 2 to 3 weeks after, say, 4th of July, other holiday weekends. And as a consequence, we are very cautious in terms of our approach as we move forward. We are going to hold the line in terms of the approach we laid out in partnership with counties up and down the state. This partnership continues. It's an iterative process. I'll just give you an example. There are a number of counties that we are working with in real time over the course of the next few days, which we are comparing and contrasting certain data. It's a way of expressing this. It's dynamic. It is a process where we are doing all we can to be as responsive and inclusive as we should be under these circumstances, but progress being made as it relates to taming the spread and transmission of this virus, demonstrable in that 7 and 14-day positivity rate, and exampled here in the county tier status, where we have new counties moving forward into new tiers, which provide more activities and more opportunity to get us closer to normalcy.